Are you struggling with dizziness or vertigo? Or perhaps you're pregnant and you're struggling with some pregnancy-related pain? Or do you think physiotherapy starts and ends by lying on the massage couch? Today on the Wellness Shift podcast, we are speaking with one of our senior physiotherapists, Elena Gel, who specializes in MSK, women's health, and vestibular physio. Elena is going to help you understand what are the telltale signs you should be looking for support, what problems pregnant women usually struggle with, and why you should not wait to see a physio if you're struggling with dizziness. Hi, I'm Bruno de Jong, physiotherapist and founder of CBA Clinics, a physiotherapy and wellness business based in London, with clinics in Waterloo, Canary Wharf, and Elephant and Castle. We are passionate about helping our communities stay active and pain-free, no matter their age or starting point, by uplifting their physical and mental well-being through expert physiotherapy, movement, and mindset support. Each week on this podcast, we bring you real conversations with clients, physiotherapists, and health professionals to explore what it really takes to feel well and stay well for the long run. So, Elena, welcome to our podcast, The Wellness Shift. It's great to have you here.
Bruno, thank you so much for having me. Good to see you again.
Great. So, Elena, you've been with us now. How long have you been with us, and how has your journey been with us?
It's a little bit like forever, but yeah, I think we are together for about 2-3 years already. Because I started as a self-employee, and we had a year where I was just adjusting to the clinic. I was working with you and with a different clinic, so it's been a little bit of a separated Elena in both clinics. But then when you decided to shift the business model, I said, okay, you know what? I'm just gonna stay here. I like it, so I felt like it's just the right place for me as well. And yeah, I became an employee, I think, last year already. And since then, I'm just doing my work as a physio and just progressing from there with doing loads of things with patients and then admin tasks as well, such as we can. But I think it's been great. Like in total, it's been great. It's been really cool.
And you're one of the therapists that, so you've been now the longest with us out of all the rest of the team. I feel you were always consistent, and not just with the adjusting to where the business is going, but also with your clients. Like the reviews and the feedback has always been good. I don't think, and I can actually, I'm gonna start again. I'm 100% sure that we have never had a complaint since you've
Well, I
been with
hope not.
us.
I hope not.
I don't think so. Have we? I don't think we
I
have.
think realistically speaking, I don't think we've ever had a massive formal complaint, which was proven to be true as well, right? So nothing like that. But yeah, in general, I try to be, to be as good as I can to my patients, and I know that they like to come to you and be listened, and I'm very good at giving that in general. Like I really enjoy listening to people and finding out about things from their life, of course, now in the context of their injury and their rehab. Um, so I feel like I'm very good at building up relationships in general. So everyone who's coming in the clinic, I'm always very friendly with them, and we can connect easily with my patients, with my colleagues, and so on. Yeah, most of the time I've been getting feedbacks. Everyone was fairly happy with my treatment, and the way that I take care of them. And I think what makes them in a way to um avoid sending you a complaint is mainly because I always keep in touch with everyone as much as I can, and I always encourage people. I'm telling them, look, you're gonna feel fine. You might have a little bit of pain here and there. You might feel a little bit of discomfort after the treatment, etc. But send me send me a message. It's 30 seconds. Just write me an email, or just give a call to my colleague and say, hey, can you pass this message on to Elena? And then if I can help with anything as fast as I can, I'm just giving them a call, or I am trying to keep in touch with everyone, as fast as I can in general. So I guess that really helps everyone to get good feedback from each other. And we also realize that treatments might be a little bit painful sometimes, or the progression is never going to be linear. It's always going to be a little bit of a zigzag, right? Like a double. Like, if you are good at explaining to people in general, and I feel like if you tell them that, look, this is how it's going to be, you're going to have a very good period after your treatment, but then you might have a little bit of a flare up. Just text me. I'll help you to go through that. And I feel like that's really making them feel more comfortable also with going through those periods until they are, I guess it's
And
good to.
yeah, and this is it, you see. I think it's really important for people to feel heard when they're coming in through the door, right? And this is exactly what you're saying. And you do this really, really well. You're really good at listening to people. And it's something that I bang on about a lot as well. And I think, but I think I never had to really even say, Elena, you need to listen to you've always done, it was always like, it's so natural to you to just do that, right? And I think by them feeling heard, you automatically gain a lot of trust with them. And just keeping this door open. And this is something that I do as well. And I think, like you say, it doesn't cost anything leaving that door open. Any problem whenever people are leaving, I always say to people, if you have any problems until I see you next, just drop me an email. It could be Saturday. Just send me an email. I'll do my best to reply. And it doesn't cost, it's like nothing, but it makes people feel cared for. And it really improves trust. And if they trust you, they get better much faster than people who are a bit like, I'm not sure I'm enjoying this physio, or I'm not sure I trust them, right?
It's not very easy, I guess, in a way, and especially if you think that most of the patients, they might have seen other physios in the past as well, right? So some of them, they just come with an already made idea about how physio should be, or, and once they get in contact with you and they communicate with you, they share their story with you. I think it depends a lot how open are you to listen to that person, and try to help them as much as you can, and you should kind of find out about what they need in general, and just give them what they need, because that's all about, right? Everyone comes to you because they need something, so you find out about it, and then you just give them what's good for them to help them recover and everything else.
Yeah, exactly. So you've got over 10 years qualified, no?
Yeah, I'm in clinic since 2014, because after my first year of university, I started to do my like a volunteering practice, but it was always a private practice for me. And then once I graduated in 2016, it was very easy for my previous employer to take me on, because I already knew everything about the clinic. My colleagues were very comfortable with me, so it was a very smooth transition in a way. Yeah, 10 years of clinical practice, basically.
That's brilliant. And
Feels a
that
lot.
is a lot. And over this time, I mean, so you've been with us for almost half of that time now. And even during this half of this time, these 4 years, I've seen a lot of growth in you. And then suddenly another skill comes in. I say, oh, by the way, I'm doing this now. And I was like, when did you train that? Oh, I've just been training. So these days you cover a lot of aspects, not just MSK, but you going into vestibular and women's health, and now you study Pilates. So there's all this stuff that you do. So what are your favorite stuff to treat, or favorite conditions or type of?
That's a very good question. That's a very good question. Yeah, I do loads. Or at least it feels like I do loads, right? Because I do MSK, and I do enjoy MSK is my base for everything. And then yes, I did vestibular as well, and women's health as well. So I'm trying to use my basic knowledge and just add up to that, because each of them, of course, is a very broad topics. MSK, you can literally teach everything in your body when it comes to joints and muscle pains, right? And then women's health, it's about so many things, but I have like a few things that I like. For example, when it comes to MSK, I really enjoy working with athletes. in general, if there is anyone who's been injuring themselves while doing the sport. And as I've been doing some running, I think, I'm very busy assessing runners. I've been doing a little bit of paddleboarding, wakeboarding. So I'm trying to use my skills into the areas which I'm also practicing that sport mainly. When it comes to body parts, I think I kind of link them with the women's health now because I work a little bit more with pregnancies. So there's always going to be some pain around the back, pain around the hips, knees, lower limb, upper back mainly. So I'm trying in my MSK practice to focus on doing those most of the time as well. And vestibular, the same. I'm not covering like all the vestibular area because it's a lot. It's a lot, and there's a lot to study. And first you need time for all those. So I'm just picking bits and pieces from each domain and I focus on those. I study whenever I have the time. Yeah, I'm a little bit of a nerd when it comes to that, right? I really enjoy learning. You're always gonna see me doing the, I don't know, symposium, or next week I'm just going to a martial arts convention. It's great. It's great because it gives you a lot of freedom to work with different people. But yeah, I usually I would say that I would prefer someone who's feeling cozy to see them in my practice, to assess them. If I can help them straight away, I'll just do it without any problems. If I feel like they need a little bit more, I'm always gonna refer them further. If it's someone with an MSK pain, they just injure themselves, I think I would say maybe they're anything related to the spine, hips. It goes really well for me. And when it comes to women's health, I'll stay for now with pregnancies. I quite enjoy working with mothers to be. Yeah.
So what problems are you resolving for mothers to be? When they come into clinic, what are the usual problems that you're trying to resolve for them?
So in general would be any pain around the girdle, around the pelvis, I would say lower back pain, hip pain, ankle. They can get a little swollen, they can get some discomfort because of the weight that they are putting on during pregnancy and so on. But most of the time, women are coming because of pelvic girdle pain or lower back pain and hip pain. So these are the main issues that I'm seeing nowadays. It can be early during the pregnancy, or it can be a little later because before they are delivering. Yeah, but most of the times this would be lower back, ankles, and pelvic girdle pain.
And then
Yeah.
would you say that your treatments for these ladies, of course, you mentioned quite a few different aspects there, but is it quite half between exercise and manual therapy and then education?
Yeah,
What can
so
people expect?
in general, there's gonna be like the usual assessment that we are doing. So we have to see how are they moving, where is the pain. So we have to assess all those aspects as well. And after that, there's always gonna be a part of education because they have to know what's happening with their body when they are getting pregnant, and how are their hormones behaving, and what changes they should expect during the pregnancy and maybe postpartum as well. So that's quite important because the woman's body is never going to behave the same way before and after pregnancy. So you have to kind of explain to them and prepare them for all those changes so they don't say like, oh my God, what's happening with me? I don't know what to do. I'm in this situation and I want to do this and that. So there's always going to be that part of education, which I feel like it goes always throughout the treatment. So it's never going to be just one session where I'm giving them everything I've been studying in maybe a couple of years. It's always going to be like a little bit of education during every session. And then from there, we can do some manual therapy as well. That's usually the case. I kind of enjoy maybe starting my treatments with a few minutes of manual therapy just to make sure that the patient is relaxed and he is prepared for the rest of the treatment, right? When it comes to exercises, it depends a little bit where they are. If it's someone who just had, I don't know, intense pain, of course, their exercises will be very gentle. They will be very, very minimalistic, nothing that could make them flare up or anything like that. So I try to take it to be as systematic as I can. So I do the education part at the beginning, or maybe even throughout the session. Then we go through our manual therapy and the exercises as well at the end. And I make sure that, everyone knows what they have to do at home. And again, if they have any questions, because maybe they forget something that I say, text me and we can chat. I can review them with you again. But yeah, in general, that would be that's what someone who's coming to see me should expect.
And with the vestibular,
Hmm.
what are you trying to resolve when they book in a session with you?
I think I really like vestibular. I always feel like patients which are experiencing vestibular symptoms are quite interesting because there's a lot going on in there. It's not just about the physical impact that they are feeling, but it's also about the emotional impact. So just to give you a little bit of an idea, when I speak about vestibular, I'm referring to someone which is experiencing dizziness and vertigo in general.
So what can I just ask? What's the difference? Because people are not going to know. Because I didn't know this. I know now. But what's the difference between dizziness and vertigo?
So when it comes to that, so the dizziness basically is like a sensation that you are a little floaty, you are a little eerie. There is a little bit of blur vision that comes. My patients are describing their dizziness in so many ways. They are feeling woozy or they can't focus properly. But when you say vertigo, you feel spinning. And it's either you feel yourself spinning, or when you look, the environment around you is spinning. Now, it can be rotational, it can be up and down, doesn't matter, but it's like a motion. So when we speak about vertigo, it's like a motion of your body or the environment that you are seeing or feeling. So that would be when dizziness is more like a wavy sensation or like a blurred vision, and the vertigo is just that spinning sensation that you are getting.
And one thing that you taught me was, because I had a client once here near home.
Yeah.
Yes, and
Remember
he
that.
had a young guy in his early 30s, and he was having some back pain, but he was also having some dizziness. And then you said to me, well, check if it's not cervical, so if it's not coming from his neck, and if it is, just do a little massage here and there. But if that doesn't resolve it, it might be okay. Right, it might be a case for vestibular. And that made me think, wow, this is really affecting a broad range of people from any age, almost felt like. So what's the age range that people might experience this?
I think you will be a little surprised here at this. I've seen patients, the youngest that I've seen, if I remember well, was about 12. I know.
No way.
Yes.
What was going on there?
Well, it was just an ear infection, if you could believe. When there are multiple causes of which are causing dizziness and vertigo, and like you said before, because I asked you, okay, go and do the cervical test, because sometimes there might be just tightness or some discomfort around the cervical spine that can create that dizziness that the people can get, right? But in most cases, people would come after they are getting maybe a ear infection, and that's inflaming the internal ear, and that can cause that vertigo sensation. Or there is the most common, I think everyone knows about the VPPV, which basically happens when inside the ear we have a liquid which is circulating. But inside that liquid, we have some crystals. And those are very important because they are recepting, they are, say, basically, let me see how I can explain it. So they will help you understand where are you finding yourself when you are standing. Okay, where if they intercept the head movement, and then they are like a GPS for your brain.
Like spatial awareness, sort of.
Exactly.
Right.
Exactly. But from time to time, because you are doing certain movements, or maybe you are turning yourself fast, or I don't know, you are sleeping in different positions, those crystals can get a little stuck in the ear. So you have to go and do a technique, and then after that technique, you will unlock those crystals, and that's gonna take away that vertigo sensation. It's like it's a lot that's happening, and there are loads of pathologies. That's why sometimes I know that most of my patients, actually, if they are coming for a first assessment, and I say, "Oh, I can't do this with you. I need you to be seen by a consultant, or I need you to go and have this diagnosed," is because I know that vertigo is a symptom, and yes, it can be caused by your spine. It can be caused by your internal ear. Then there are other neurological. It can be caused by the cerebellum. It can be caused by a problem with the blood vessels. So you have to be very, very careful when assessing patients with dizziness and vertigo in general. Challenging, and as I was saying, it's caused by multiple causes. It's impacting usually people physically, and I was saying before that emotionally as well, because it's not easy to go from your life where you were very active, and then the moment you turn your head or you open your eyes or you just close your eyes, you feel skinny. You can't stand that. It's really difficult. It's really difficult in general.
Wow. It's crazy, isn't it? Yeah, my dad had, I don't know if it was vertigo or dizziness, which one he was having, but it did affect him somewhat. But he's always think those things or that kind of symptom will trigger more in someone who's older. So I'm so surprised to hear how young this can happen. But it makes sense then, right? So ear infection, of course.
It can be
So
more common in the geriatric population indeed, because, we have all the senses, the eyesight is getting a little lower, then the hearing, maybe they start experiencing a little bit of hearing loss. And yes, that's going to cause some problems with balance, and it might cause some vertigo and dizziness indeed. But that's why they always need to be checked.
Yeah, always do your due diligence. Yeah. So what would you say for someone who is either experiencing women's health problems or even some vestibular issues? What would you say is a misconception have about physiotherapy when they come in? What are they?
Yeah.
What are the misconceptions that they come in with sometimes?
Well, that's an easy one. That's an easy one, because majority of people, they have been to a physiotherapist, they already have some experience, so they come and ask for maybe a plan. One of the misconceptions is that everything can be sorted manually, and that if I am doing a massage or if I'm doing a technique, that's gonna take all the problems away, which is I sometimes I find it a little bit of a, let's call it a little bit of a red flag, because not everything can be done at the time. Physiotherapy treatment is never about having a massage or having the manual therapy. That's for sure. We need to make sure that after we are assessing our patients, it's safe for them to get anything manual done, because a technique can go wrong in so many ways, and without you realizing, it's just, maybe, I don't know, it happened to me before, to have patients which, for example, I would go to the assessment with them. I would say, okay, let's maybe try to do this, and then we can see how do you react. Then during the treatment, they would mention something that, I would have reconsidered my treatment at that time. So I feel like physiotherapy's treatments, like at least the first session, should focus more around explaining, understanding what's happening with themselves, having a plan in place, having that plan. And I feel like we should kind of understand that physiotherapy is not a quick fix. And I think this is one of my messages for everyone who's listening a podcast, for everyone who's going and seeing a physiotherapist. You don't have to go there thinking that, oh, you know what, they will just do a clip and pop, give me a massage, and I'll be fine the next day. It's probably not gonna bring you any benefit, at least not on yourself. For short term, you might feel, your muscles might feel a little bit more relaxed. Your pain is probably gonna go away. But on long term, you from the physiotherapist that has been studying and knows how to keep you safe, knows how to help you on long term to live your best life. We need to make sure that we are educating our patients properly. They need to get proper education, first of all. They need to get support. And this is something that I've been noticing lately with my patients, because they are going online and they are doing their research. And they found, well,
ChatGPT.
it happens. And, they found, well, I have these many options that I can do, but how would I know which one works for me? And I'm like, well, that's why I'm here. And I'll summarize it. I have this amount of knowledge. I've been studying these things. So when you come and you speak to me, you give me this much information, I analyze it, I make it small, and I give you the piece that you actually need. So that's what I think everyone should focus on, their initial assessment, and then just live from there with a plan. To know what's the next step after your session or during your session. The physiotherapist feels comfortable with maybe giving you a massage. This maybe there's nothing that would affect you. We will do it. Like improving myself, I'll do it. Okay. I'll give you that massage. I'll do that manual therapy for you. But if I say I'm not very convinced about it, it's because I know that it might go wrong, or I know that this may be not going to benefit you on long term, and you might actually benefit from something else. And I don't want to delay that something else just because you want to have a massage. So that, yeah, I feel like the misconception in general is that they need to have something manual done. They have to be careful with that.
Yeah.
It's like extremely careful.
I think people these days they don't want to be accountable for their problems. They want someone else to fix it. So by them coming in and say, "I'll just give me a massage and then I'll feel better," and that's it. That's the end of it. That's them not being accountable for it. And I think this is a big thing for me, accountability, right? And I think this was the word of last year for me. During 2020, 2024, that was the word for me, because I think I was going through a period of diverse situations as well. And I realized, actually, I'm not being accountable for this, this, and that. And then once I became, I started noticing how other people are not accountable for their stuff as well. So it is everywhere. Every now and then you speak to someone about a problem, and then you come across, it could be a service provider, it could be a client, it could be anyone, it could be in your family, right? This is quite a big thing. And I think it takes a lot of education for people to realize, gosh, I need to step out of my comfort zone, and actually I need to do the work if I want to see results, because nobody can fix things for you, right? You have to. And I think you hit the nail in the head that you can do the manual therapy. You're not treating the root cause.
No.
You're treating the
Certainly.
symptoms. It's going to make them feel great for a few days, sometimes hours, and then it's back. But they really got to crack on with their homework, right? Which is going to be changing life habits, doing some more exercise, whatever it is.
It's
Mm.
Yeah, I also feel like we are one step closer to actually having more accountable people as well. Like I do realize that the majority, is not happening with everyone. So I think, because you remember, like every time I have a little icky or something with any of my patients, and I feel like, oh my God, I don't know how to manage this person, or I struggle with maybe connecting with them, or I really feel like this person I'm gonna lose them, because I don't see that they're either not open, or they're open but still they wanna do their own thing. And it's not insanely common. Yeah, it's difficult for some people, and to take accountability, and to actually do the things by themselves, which again I don't understand. I would also love to have someone who is doing things instead. I actually just said to my flatmate today, I would love to stay at home and get money. It's okay, it's very system. That'd be fun, right? It's not possible, not in this society, like not in these times. And I don't know. Now maybe that's my personality, but I like to take ownership in general, and I feel like I'm projecting maybe sometimes this on my patients. So maybe that's where the expectations are coming from as well. If there is anything, I'll just take ownership. It can be a bad thing, it can be a good thing, but it's mine. I did it, right? I went wrong about it, fine. It's a mistake. Everyone does mistakes. Let's learn from it and let's go forward. And I feel like, when it comes to accountability, that's maybe something that people can think of. Make it yours. Is it good? Is it bad? It's yours. You know what you did it. Making the mistake, well, that's it. Everyone does mistakes.
Yeah.
And that's fine.
But I think, you being like that, you are able to pass on that message of be accountable to your clients with a lot more ease because you're accountable for yourself. So I think when we're accountable, we can word things in a way and we can influence them to be accountable for their benefits with a lot more ease than if you are not accountable for your life and you're sort of just messing around a bit and you're trying to convince your clients and then they might and then then you might build some frustration there because they are listening, but then you also are not doing your bits. So because you do your bit, I think your clients respond a lot better. And I feel that experience as well. I find it a lot easier to make my clients more accountable because I feel that I'm like that. But then you sort of just, they might sense it, but then the way I say things as well, they just hear it. They hear it better, I think. I don't know.
Yeah. Yeah. It makes sense. It makes sense.
So Elena, what if for someone who's, let's do a vestibular, I guess, for someone who is struggling with perhaps some dizziness or vertigo, or they don't know, do I have this or do I have that? What would be a sign that they should go and seek someone or even have a free consultation that we offer? What would be a sign that just like a little push, say, you know what, now it's time?
It's very easy with them. They can't go wrong, but it's impossible to wait for too long because if you become dizzy, you become dizzy. But I think in general, people should pay attention to a few things, maybe like losing hearing or feeling that their eyes are not functioning like before, or that they are getting lightheaded or they are tired most of the time. Of course, you notice when you are dizzy, although as I said before, dizziness can be given by, again, by multiple pathologies, etc. But if you do feel that something is happening with your hearing, with your eyesight, you start having headaches, you start feeling like you can't focus properly, that's a sign that you have to do something. You have to check it out. It's maybe it's enough sometimes just to speak with, in my case, you can come and speak with me because I'm studying this particular area in physiotherapy and I am passionate about and I'm learning more about. So if you come and you tell me this is how I feel, I'm going to be like, okay, fine, listen to me, let's go through a test, let's see what's happening. If I can help you now, I'll do it now. Although if I think that you need to be seen by maybe an ENT or your GP or a neurologist, I'm just going to send you there. But in general, I wouldn't wait until I get extremely busy, although sometimes it might happen just out of nowhere. And in general, I feel like most of the vestibular patients don't really notice it until it happens. The signs are so subtle, and sometimes the people are so disconnected from their body that they really don't pay attention to their body that much, right? And they just woke up one day and they feel like the world is spinning with them. So yes, it's easy for the ones which are in contact with their body and they are noticing, that my head is not feeling right. I can't work properly. My concentration level is down. There's something wrong with me. But for someone who's not that aware of how they feel, or they don't know that feeling that way is not normal, it's gonna be a little bit difficult. But I would say hearing is the easiest one. If you have any problems with your hearing, if you have headaches, if you are feeling like you can't focus properly when working, or maybe, I don't know, just when coming out of your house from a dark environment to a light one, just check with me. Check with me, or check with any vestibular physiotherapist or with your GP.
And what might happen if they just sort of sit on it and wait a little bit too long? What might happen then?
Anyway, come back. Come back at some point. Okay, so whoever is not really checking onto their symptoms, at some point they will actually take the phone and come as an emergency. Oh my God, I can't stand up from the bed. What shall I do? They might not even be able to make it to the clinic. Like it happens loads of time for people to know. They're just not capable because they can't stand up from the bed. They have maybe dizziness and vertigo for hours, for days. So it's either way. You can come when you start noticing mild symptoms and you check them out and you try to see where is the vertigo coming. Remember that it's just a symptom. Dizziness, vertigo, lightheadedness, these are symptoms. Okay. The diagnosis sounds a lot different and a lot different. But when you feel those symptoms, speak to someone. Tell
Let's
them this is how I
investigate.
feel. Exactly.
Yeah.
Let's check it out. Otherwise, they will just come when they are already losing their balance, when the vertigo is persisting for days, when they are nauseated and they can't eat, they can't work. Like most of the patients which are coming after a vertigo episode, they need to have days off from work. And I'm not talking about a day or two. I'm talking about weeks, maybe sometimes months. So it can, you know, but
Yeah.
really, and this is also for someone with an MSK issue. Like the same thing. If I feel like that my muscles are tight or I feel a little stuck and I wait for a couple of weeks, I'm fine. And then I just come with a bigger pain. Of course, for the physio, it's gonna take longer to sort you out because the pain is there. There's an inhibition that comes into your muscles, into your movement patterns, etc. That we have to sort out, and that doesn't take a day or two. That takes weeks to months to sort out. So don't wait. Wait for the real issue to come in. Once you notice a little bit of discomfort, speak to us. It's important.
Great. Elena, it's been such a pleasure to have you in the
Thank
podcast
you.
today. You really, to me and to our colleagues, I know that you are really inspiring because you're really caring with your clients. You're accountable. You make them accountable. You just tick so many boxes with the clients. And it really, and I know this from the juniors that shadow you and you train, they really feel inspired and they end up doing a much better job because of that. So thank you for being a great
Perfect. Thank you
physio for
so much
us.
for that.
Yeah.
Well, I guess time is also helping me. I guess the more time you spend in this physiotherapy world, the more you learn, the more you develop. And
Yeah, definitely.
but thank you so much for having me as well.
My pleasure. My pleasure. And for anyone who's listening, I hope this was valuable somewhat. If you guys are experiencing any symptoms such as what Elena has described, just get in touch. We offer 15 minutes free consultations, and we could always hop on the phone as well with you guys to see if we can advise you in any way. Elena, thanks again. To our listeners, we will see you all very soon. Thank you so much.
Thank you.